Hi, this is Kate, and today I will be comparing and discussing differences between fibroadenoma and hamartoma. So upon starting my research, I learned that another name for hamartoma is fibroadenolipoma. So what I'm comparing is fibroadenoma and fibroadenolipoma. If I were to just break down the words and try to define them strictly by their etymology, the only difference would be the lipoma, or fat. So these are definitely very similar in composition, and I can see why we're comparing them. Let's start with fibroadenoma. This is a benign tumor made of a mix of fibrous and glandular tissue. It is more frequently an issue for younger women, being most common in ages 15 to 30. And it is pretty common, occurring in 10% of all women. When palpated, they are described as feeling like marbles, firm, round, movable, rubbery. That's why I have a picture of marbles here, so we can remember what they feel like. And for the women who don't have them presenting as palpable masses, they are completely asymptomatic. They do not fade with the menstrual cycle, as many of our other lumps and bumps do, but there is speculation that they are dependent on estrogen. This is based on the fact that they are more common with premenopausal women or postmenopausal women who are taking estrogen. They also tend to increase in size during pregnancy. Now the hamartoma, or fibroadenolipoma, is also a benign tumor. This one is composed of fibrous, glandular, and fatty tissue, usually surrounded by a thin capsule of connective tissue. And while the fibroadenoma was more common in the younger population, the hamartoma typically occurs in women who are older than 35. So that's a difference. Another difference is how they present themselves. The hamartoma displays clinically as a painless, soft breast lump, or as unilateral breast enlargement without a palpable mass. That's different because the fibroadenomas were firm, like marbles, but these are soft, if they're even felt at all. They can also be completely asymptomatic, which is the same as fibroadenomas, so that's something they have in common. Now the breast within a breast, or slice of sausage, has more to do with their radiographic appearance than how they are to the outside observer, which I'll show you when we get to the pictures. But the breast within a breast also refers to the composition of the tumor. It is made up of all naturally occurring components of a normal breast: fibrous, glandular, fatty, within its own little sac, so it's almost like another tiny breast within the existing breast. And I put this sausage picture here so we can remember what this one looks like. So here we have what the fibroadenoma looks like radiographically. It can present in a variety of ways, such as a well-circumscribed discrete oval mass, or a mass with macrolobulation or a partially obscured margin. It may or may not contain calcification, which, if it's there, would be either popcorn or microcalcifications. Here's a few more images of fibroadenomas, just so we can see what they look like. And remember, these are benign, so even though they really stand out, they're not something that usually causes a problem. Here we have the hamartoma. Now this one presents radiographically as a well-circumscribed round or oval mass surrounded by a thin capsule. It's interesting looking because it has both the fatty and soft tissue densities inside, the fat being radiolucent and the soft tissue being radiodense. And this is where you can really see the breast within a breast, or slice of sausage appearance. Here's a few more hamartomas, looking just like the slice of sausage in the picture on the left. In the picture on the right, the composition of the tumor is so similar to the surrounding breast tissue that it really blends in. The breast within a breast. So another imaging modality besides X-ray that is helpful for imaging both of these pathologies is ultrasound. On ultrasound, the fibroadenoma is oval, parallel, and circumscribed. It is a uniformly hypoechoic mass with echogenic, thin, fibrous internal septations. Its posterior features vary depending on the composition of the mass. you can see calcifications in approximately 10% of these tumors and internal vascularity in up to 80%. The hamartoma, remember, resembles normal breast tissue. The margins can be difficult to delineate because of its similarity to its surroundings. It may be seen as a well-circumscribed solid lesion without internal microcalcifications. Because of its makeup, it shows up as a mix of hyper and hypoechoic components. And once again, it is soft and easy to compress. The populations that are most at risk for these pathologies are very different for each one. Fibroadenoma is found more in the younger women, hamartoma in women as they age. Fibroadenoma is said to occur more in women who have a family history of breast cancer, while hamartoma is more common in women with some genetic syndromes such as Cowden's disease. In fibroadenoma, 10 to 15% of patients develop multiples, and this seems to be weighted more towards people who have a family history of it, while hamartoma doesn't really have statistics on multiples. Fibroadenoma is hormonally sensitive and fairly common, while hamartoma is not very common at all. So if you have either one of these pathologies, they are taken care of in similar ways. Biopsy is the first step to confirm what is going on, and luckily both of these are usually benign tumors, so they aren't really going to cause much damage. For the most part, they can be left alone and monitored, as long as they are small and not causing discomfort. But both of them can be surgically excised if they are causing discomfort or getting too large. As far as long-term care goes, it is basically the same as any other woman with or without a benign tumor. Get routine mammograms, perform monthly breast self-exams, and try to maintain a generally healthy lifestyle, including getting exercise and limiting alcohol consumption. So it turns out that neither one of these pathologies is that bad, though it's probably scary to find anything strange in your breast until you have answers for what it is. But that's why we're doing this, to help women in all aspects of their breast health.